Yes. Okay. Well, welcome everyone. I appreciate everyone's attendance tonight. We've got some important information to share. My name is Rick Van Vranken, Atlantic County Ag Agent. My colleague Wes Klein in Cumberland County and I are your hosts for this evening. Although the person in control of the computer is Wes's able assistant, Jen Matthews, who works with him in the food safety program. And we thank her for doing that. She knows the system a whole lot better than I do. And hopefully we'll have this recorded properly so that in the event that others want to see this afterwards, we'll be able to give that to them. This is actually, I was going to say that for about 35 years now, Rutgers Cooperative Extension, both Atlantic and Cumberland County, have been collaborating with New Jersey Farm Bureau to co-host spring regulatory updates regarding mostly labor, but also pesticide issues and other on-farm regulations. That was all scheduled and ready to go for March, and we got preempted by a pandemic. And now this is the more important topic that we need to address going forward. So we're glad you're able to join us tonight. This is an important update, and we want to thank the Department of Ag and the Department of Health and Department of Labor for coming together to develop a guidance for migrant and seasonal farm workers and their employers and housing providers. It's a serious business out there, and we want people to do everything they can to protect their workers, their family, and themselves. So we've got a fairly tight schedule tonight. We're going to open it up for questions. As far as the ground rules, if you have a question, please type it in the chat box, and we will address those questions as they proceed through. We'll take a couple of breaks at different times throughout the event tonight to answer a few of those questions. And if not, if you don't get it answered there, we'll have another Q&A at the end for everyone to have a chance to ask their questions then. The other thing is when you log off, there'll be a quick 3 or 4 question survey. It's supposed to happen if I set this up correctly, just to get your feelings about how you've been doing in implementing the guidance so far, and if you've had any issues with it. So without further ado, I'm going to introduce our Secretary of Ag, Doug Fischer, from the New Jersey Department of Agriculture, to have a few introductory remarks. Doug, take it away. You got to unmute yourself, Doug.
So yeah,
there you go.
Okay. So thank you, Rick. Thank you, Wes, Rutgers, and also the Farm Bureau for organizing this event. I know that it's important, and I know that most of the people in the farm community started long before the sun was up, and here we are heading towards sundown. So it's a long day, but it's an important subject, and I'm glad that everyone's taken the time to come on and hear some remarks about the guidance for migrant and seasonal farm workers, their employees and housing providers. You all got the interim document earlier on, and now we're moving into some further explanations now that we've been living with this for a short period of time. So COVID-19, we know it's threat. We know it's a threat to the workforce. It's a threat to our farmers, and it's a threat to the public. And we're glad that the 3 departments were able to work together to create the best planning we could for the safety of all concerned. A lot of plotting, a lot of planning, and I know it took a little while to get it out. We wanted to get it tuned up as much as we could to make sure that it's workable and also provides the necessary precautions and safety that's so vital. It's best practices of courses of action, and we're working under, frankly, the Department of Health and Commissioner Fqhc, rather, knowing that we all must cooperate with these health guidelines. Now, it's cumbersome compared to how we did business last year, but we know that it is absolutely necessary from a health perspective and also from a business perspective. Now, we've engaged the Fqhcs, and they're there to do the testing, to coordinate where necessary. And one of the points that I want to make is to urge our farming communities and the farmers to welcome them and appreciate the vital service that they're providing. There's no cost that I know of. They may be telling you something, but but I'm pretty sure all this is provided at no cost. Particularly, I also want to point out that Amanda Medina Forrester from Health, Christine Bluemower from Labor, and Monique Purcell from Ag have been coordinating this together through these three departments and with all, of course, their staff to make sure that we're doing the best job we know how to make sure that there's safety involved for all concerned, as I said, but also understanding the ramifications on the business side of what it's going to take to make sure that this is all coordinated and working well. This is a meeting to help make sure that everyone has an even clearer understanding of how they can work as effectively and efficiently with these guidelines, as I said, under health, to make it the best possible conditions that we can arrive at for what it is that we need, so that we can have our farm workers and our farms providing the products for New Jersey and the country. So I want to also thank Farm Bureau and mention Pete is going to be the moderator, and I urge you to have your questions, type them in, and hopefully this is going to be a very, very important and enlightening exercise. So thank you, and I'll turn that back over to Rick, or Monique, rather.
Thank you, Secretary. Just wanted to introduce the speakers and the presenters that we have tonight. We have Amanda Medina Forrester, who is the Executive Director of the Office of Minority and Multicultural Health at the Department of Health. And she has along with her a co-presenter, Siobhan Pappas, who is the Coordinator of Childhood-Led Program in the Office of Local Public Health for the New Jersey Department of Health. And we also have Christine Bluemower from the Commissioner's Office. She's a policy advisor from the Department of Labor. And we're also really glad that we have two representatives of the federally qualified health centers. We have Michelle Blanchfield from Zufall Health, and we also have Bridget Hogan from Ocean Health Initiatives. So they will be presenting tonight and providing some feedback, and also here, obviously, to answer your questions at the end of the presentation. So I'll turn it back over to Rick to introduce the first speaker.
Good evening, everyone. This is Christine Bluemower from the New Jersey Department of Labor. Thank you so much for the opportunity to be with all of you tonight, and for the introduction, Secretary and Monique. And I just want to start us off with just echoing Secretary Fisher, meaning that we all appreciate how hard you are hit by this pandemic in the agricultural world, and which is also why particular statewide attention was given to the agricultural sector from the onset of the pandemic, and why we've been really working hand in hand among these two sister agencies to make sure that you are best equipped to weather this awful situation. We want to make sure you can stay in business. And we know that this can only happen if you protect your workers as well as yourself and your family members. We hear often these days that we're in this together, and I personally really think that that's the case. I can only protect myself if I also make sure that I protect the people around me. And so that's why this guidance is critical, because as any one of us has a role to play in mitigating the public health crisis we are in. And so this is why special emphasis was given to situations that are highly critical and which are primarily workplaces where there is high workplace density, as in agriculture, as well as in congregate housing. So these days we're seeing COVID-19 numbers going down across the state, and we will only be able to see such a steady decline if those difficult environments, so meaning places that have high workplace density or in congregate living settings, if we continue to, throughout the state, abide by very stringent preventative measures to make sure that the virus doesn't spread any further in those spaces and then back to the community. We've seen also that states that have lifted measures too early are now starting to pay the price, particularly in the southern states of the country. And this may actually also have an adverse effect on us, and we'll touch upon this a little later. So we're going to move on to the next slide, and my colleague Amanda will take over for a bit.
Hi everyone. Thanks for allowing us to present today. I just want to share the Department of Health vision. Our vision is to ensure.
I don't know if it's just me, but there is a weird echo on your end.
Try again.
Hi everyone. This is still an echo. So thanks again for allowing us to speak about the pandemic and
Hold on 1 second, Amanda. It's really, really bad. Hold on.
This is different than what we had in the sound check. Do you have both headset and speaker?
No, I don't. Is it still bad?
Still not coming through for some reason.
How about right now? Still very good.
Still has bizarre feedback for some reason. Not sure.
Hey, Amanda?
Yes.
Amanda, do you want to hang up and try and log back in, and I can cover this one?
Okay.
And if that doesn't work, you may need to call in instead of using the computer.
Okay, sorry everyone for that technical issue, but it wouldn't be a good webinar if it weren't for a good technical issue. So again, and I think I also want to say up front that we're not here to do a line-by-line review of the guidance, but rather what we did was take out some important parts of the guidance just as reminders, and then make sure that we don't, get stuck too much in in monologues, but rather have enough time for questions and answers to those questions. So in terms of the context, to go back to what I said just earlier, we just know, right, that migrant and seasonal farm workers are at risk of exposure to COVID-19 because the very nature of the work makes it so that people are in close contact, and also because for any of those who rely on group transportation or camp-style housing, in normal times, it's very difficult to abide by the social distancing measures that are really some of the most critical aspects to preventing the spread of COVID. There is also a sense that agricultural workers, and that may be true for a farm owner as well as for their workers, that anyone who has been exposed to pesticides and farming crops may also be at a higher risk of severe COVID-19 complications. And in addition, we know that on average, the mortality has been greater for Blacks and Hispanics, as well as for individuals over the age of 65, and for anyone with underlying conditions or compromised immune systems. And I think, well, the guidance really speaks to the workers primarily to address group transportation and camp-style housing. In particular, again, I think that as you engage with the guidance and as you think about how to best apply it to your operations, you may also always want to remember that, again, it's by protecting your workforce, you're also protecting and safeguarding yourself as well as family members that you may have living with you who are elderly or who have otherwise conditions that would make them more vulnerable to COVID. So, and just a few reminders here. The guidance doesn't explicitly state this, but the first bullets from the guidance make reference to Emergency Executive Order 103, which states that the New Jersey Health Commissioner is responsible for executing the public health emergency evaluation, prevention, and response for the state, and that any person conducting business in New Jersey is asked to fully cooperate with the Commissioner of Health and her deputies in all matters concerning the state of emergency. Effectively, that means that federally qualified health centers are deputies of the Department of Health. And so when it comes to the testing that they are being provided, you really are being asked to fully cooperate with them so that we can mitigate the public health crisis at large. And in addition to Emergency Executive Order 103, there is also an Attorney General's opinion from 1981 that also asserts that effectively Fqhcs or anyone conducting business on behalf of the state in context of this public health crisis is granted access to farm property if it is to engage with migrant and seasonal farm workers that are on site and wouldn't even have to give advance notice to come onto farms. Now, this is not, nobody engaged in this process wants to have frontal and interactions. This is really, and this webinar is also a reflection of how collaborative we want to engage with this. And yeah, I'm also glad that Fqhcs will be able to speak a little later on to clarify what their role is and the process that they have set in place to conduct testing and prevention outreach on site for farms, which is mainly also meant to make anyone's life easier because they can accommodate your business hours and be very flexible so that as much as possible, it doesn't affect your schedule, your work schedule. Plus, it's also available at no cost to anyone involved. Okay, Shaban. Shaban, it's your turn.
Hi, everyone. Sorry. I'm Dr. Siobhan Pappas. I am the coordinator for the Child-Led program, and I also serve as the epidemiologist for the Childhood-Led program, just to give you a little background on myself. So when we started, we didn't actually start this task force until on April 30th is when we went full force. And our goal is obviously to test as many workers as possible. We could test all of the migrant and seasonal workers is actually our goal. As of yesterday, we've tested 1,724. They had, it was a 9.7% positivity rate. If we include we had 2 early outbreaks, which occurred before we actually hit the ground running with the program. If we remove those 2 outbreaks, there's a 3% positivity rate, which means actually, everyone's doing a really great job, and most of the workers are very healthy and are COVID-19 negative. We have our participating counties, which are the ones who have our migrant workers, which is Atlantic, Burlington, Cumberland, Gloucester, Hunterdon, Monmouth, Ocean, Salem, Somerset, and Warren County. So you all know that since these are your forms there. And really the goal is to keep the migrant workers healthy, as well as yourself and your families healthy. So if we can test and we know who is COVID positive, there are different things that we can do. Excuse me. There are different things that we can do to help our workers stay healthy and also to continue working. Next slide. So as you can see, what this slide is basically saying is just how the jobs are primarily concentrated in New Jersey. And as you can see, our customer service, sales, and food services are where most of the jobs lie in New Jersey, and a lot of positions common among Hispanic and Latinos are in these service industries. These industries are reliant, all of our industries are reliant on our farm workers. Without healthy farm workers, we can't produce farm to table. We can't get the foods that everyone would need. We've seen earlier in this outbreak, not the farm workers, but in general, people were scared. So they ran out to the stores and they bought a tremendous amount of food because they were unsure of what was going on. So having a fresh supply of food also gives people security. So this is a really important job. Without our farm workers, farmers, seasonal workers, we wouldn't be able to accomplish anything, right? Everyone needs to eat. So it's very, very crucial that everyone is safe and that we keep the agriculture going. Without it, nothing else is successful. So that's really our goal, is to help you be successful in this and to help you manage any issues that you may come up with, and to make sure that the workers are healthy and that you're healthy.
Okay, thank you, Shaban. So we're going to be moving into the guidance overview, which really builds upon 2 critical pillars, one being prevention and the second one being treatment. And Rick if at any point we should stop for questions, just let us know.
No questions so far, but if anybody has questions, please type them in the chat box.
Okay, Amanda, are you back?
I'm back. Can you hear me?
No, wonderful. Yes.
Okay. I'm a little worried to put on the camera, but I will talk about prevention. Thanks, Monique and Christine and Siobhan to taking over. For the prevention of this vulnerable and high priority population, we had to think very loud, very clear on what we need to do, the steps we needed to take. So a lot of the prevention practices that we outlined here came not only from the Center for Disease Control and Prevention, our federal guidance, but also other states that have an abundance of migrant and seasonal farm workers. And they have used many mitigation COVID spreading strategies to really make this clear. So based on best practices from a lot of other states that have this high number of migrant and seasonal farm workers, we designed this guidance on these pillars. So one is the prevention pillar. The first one, of course, as public health, is social distancing, wearing protective gear, using regular cleaning and disinfecting solutions to make sure that we are ensuring that we are lessening the spread of the COVID virus. Of course, we're using best practices. This is a guidance on housing, transportation, face coverings, and cleaning materials. And we definitely want to ensure that the last thing we do is put more work on the farmer, on the grower. So we try to make this as clean and tight for the migrant and farmers. For education and health screening, that's a really big pillar. We want to ensure that every grower, farmer, worker, housing provider gets as much information on COVID-19 infection and how to mitigate that spread to all workers in all different languages. So we want to ensure that you're screening yourselves and your family and your loved ones, including the workforce that you employ. So those are the two pillars for prevention. And of course, with transportation, I just also want to add that just as social distancing, we want to include that in transportation services that you provide, we ask you to social distance your workers as again to decrease the spread of COVID. Christine, is this you, or did you want to talk about the housing? Or was that me? Okay.
Yeah.
Okay.
We do have a question actually that just came in to May that I wanted to put out there because it wasn't in the chat box, and it says, "What if the men don't want to be tested?" Mary asked the question.
That's a great question. So right now we are not mandating any testing for anybody in New Jersey. We do not have the executive power to force any type of testing, but we do highly encourage testing. And this is all due to education. It's educating our workers to ensure that testing will not alleviate them from losing their jobs or any punishment. It's to protect the entire workforce and the entire farming community, including the ones that they love, their family members. And so again, this is not a mandate. We don't have jurisdiction, but we do highly encourage, and we will talk to any worker, any farmer, anybody who wants to hear this and wants to know what the spread of COVID could do.
And if I can add to what Amanda just said, and I'm sure that our Fqhc probably can also complement later on.
Mm-hmm.
It's always it's really important also to understand why our workers may be refusing to get tested, because the driving force behind the refusal, knowing that is also a way to address it, right? And so like, there are assumptions that that I can make if I hear that question based on the fact, that we know that on average, there is a high percentage of immigrant workers. We know that many of them may be undocumented, and so there is on those fronts, we can reassure anyone who that is being offered testing, right? That there is never going to be any, nobody here is going to report any of the information that's being collected to a federal agency. Everything that happens is really the Fqhcs are bound by confidentiality rules and laws, so HIPAA compliance and so on, which effectively protects the identity of anyone who undergoes testing. Could we, Amanda, do you want to go over this slide?
Yes. So in regards to housing, we just want to ensure that we are using social distancing in every aspect of the housing situation. For example, the bedding, 6 feet apart ideally, providing ventilation in the living quarters and sleeping in living quarters, staggered eating times, washing times, where they congregate, such as a living space, make sure that not everybody's there at the same time, let's stagger those. And just overall promoting that social distancing theme throughout all pieces of this workforce. Again, like I mentioned before, transportation it's very crucial that we try to stagger transportation with different workers coming in different times. We had recommended 50% capacity, and then of course using all types of face coverings, masks when needed and when available. We also encourage the housing providers to assign somebody to disinfect and clean regularly. So maybe the workers are taking different shifts to ensure that the house and the transportation is disinfected on a regular daily basis. Next slide.
We had one question back on the testing, and that is what type of testing is being used? Is it the deep swab, the outer rim swab, saliva test, and also these free tests? Are they open for non-migrant workers, including owners and family working on the farm, or just the migrant labor pool?
So for this initiative, we are using the interior outer swab. It's not the one that goes all the way up the pharyngeal. It's the one that goes on the rim of the nose. And anybody, regardless of migrant worker status or farm worker status, could use this as well. And there are different types of tests, but for this initiative, we are using the nasal swab that's interior.
And the farm family is at no cost?
Yes, and no cost to families and farm workers. Siobhan, did you want to add anything else to that?
Yeah, so we keep talking about the use of masks, and I just wanted to clarify the reason why we talk about masks and why we ask people to wear masks is because COVID-19 is spread primarily through small droplets from people, from talking, sneezing, coughing. We every time we do any of those things and breathing, we actually give off these little tiny droplets. So most people who are positive, who would test positive for COVID-19, many, I should say, aren't really, really sick, right? So a lot of people can be asymptomatic, which means they're not showing symptoms. They don't develop these symptoms, the severe symptoms of COVID. They may, some may have very mild symptoms and think that it's allergies or a cold. People can also be pre-symptomatic, which means they are infected, but they haven't shown symptoms yet. But all of these things, whether they're asymptomatic, have mild symptoms, or pre-symptomatic, can all still spread COVID-19. That is why we have people wear masks, right? It's to protect in case we are carriers. It is to protect those around us. So I may be positive and I may have very little symptoms, and that's how COVID-19 affects me. But that doesn't mean that it's going to have the same effect if I spread it to someone else or one of my loved ones. If someone has different underlying medical issues, they may have a much worse case than I do, or it just might be their body reacts differently. So in that instance, I may not even realize that I have COVID-19, and I can spread it to those around me and have no idea I'm doing it. Whether it's I'm not showing symptoms yet, I don't develop symptoms, or my symptoms are so mild I think it's something else. So I just wanted to. I'm sorry?
Related to that, there's a question that growers are asking if workers in the field have to wear masks.
So, this is Christine. Can I just chime in?
Yeah.
Or?
Sure.
Right. So, whenever possible, first of all, it's promoting social distancing. In addition, yes, wearing a face mask is recommended at all times, unless a worker is eating or there is a medical or the person has a medical condition that would make it inadequate for them to wear a face mask. Now, again, like implicitly what I'm hearing from that question, right, is I'm assuming that it's not always really easy to be in the field with a face covering, because if it's crazy hot out there and I'm still unfamiliar to Fahrenheit, so I only have Celsius in my head right now. But if it's very, very hot and humid, the way it often gets and the way it's going to hit us all, as soon as this coming weekend, it may not always be easy for workers to keep their face mask on at all times. And we understand that. So again, and I will then defer to health, but if workers are able to stay away from each other, at least 6 feet apart, then this may be an alternative option. But for workers who are in close contact, the face covering is essential.
So moving on to the prevention. So again, just to reiterate, mass testing in all populations is critical to check the spread of COVID, how fast it's moving, how fast we could keep it from spreading to other populations, to our loved ones. And so this mass testing is critical. And it's so pivotal for us to have partners that will do this. And these are the Fqhcs, the Federally Qualified Health Centers. The 4 Federally Qualified Health Centers have long-standing relationships with growers in their communities. Southern Jersey Family Medical Center, Complete Care, Ocean Health Initiative, Sioux Falls Health Center have all in many, many years have gone and done outreach, education,
building awareness and relationships within growers. So it was a perfect match, perfect situation that these 4 federally qualified health centers were asked by our Commissioner of Health, Judy Persicelli, to run the testing piece. So this is the part where I am really proud and humbled to be with the Fqhcs and learning from them. So the 2 Fqhc leads that we do have today on this call that could kind of shed some light on some challenges and some successes are Zufall Health Center's Michelle Blanchfield and Ocean Health Initiative's Bridget Hogan. So I'm going to first ask Michelle if she could talk a little bit about her challenges and her successes on testing. Thank you.
Hi, everyone. This is Michelle Blanchfield from Zufall Health Center. Great to have a few minutes here to, number one, describe what it is that Zufall's offering to our growers in our service area, and lend a hand as best as we can to provide education and prevention messaging around COVID. We have reached out to a number of growers already within our service area, and I want to say, so far has been a growing disinterest. So definitely understanding what the barriers are on your end is helpful for us. We're reaching out, like I said, to bring a COVID health education and prevention message to your workers. Everything is set up outdoors. We're trying to do as much as we can outdoors. Some of you in Warren and Morris County may know Xavier Martinez up in Sussex County, Esperanza Gonzalez, and Xavier worked all in Hunterdon as well. And we're starting to get into Somerset now too. So if you are a grower in any one of those 5 counties, Hunterdon, Morris, Somerset, Sussex, and Warren, please reach out to myself. You can email me at mblanchfield@zufallhealth.org, or you can call me at the office at 973-328-9100, extension 323, and just let us know. Otherwise, we'll start going out and just stopping by farms and bringing our prevention message along, so that we can help mitigate the spread. Just to emphasize the same thing that some of my colleagues had mentioned earlier from the other departments, we are really just trying to keep everyone safe. Farmers, growers, their family members. We have some success stories out in Sussex County. One of the first farms that we tested, it was a small farm. It was just 12 workers and the grower, and everything went great. We provided one-on-one health education. We have some really nice giveaways that we give to the workers, including bug repellent. We have, as long as they last, we have some long cotton long sleeve tees. We have some wide brimmed hats. And we bring an education message. Right now, it's primarily around COVID because it's still here. We're all at risk, and we want to protect one another as best as we can. And we're just trying to reach out. So you can email me or call Xavier. And we've been out in Somerset County also, tested a small farm up there with about 14 workers. The grower, the farmer got tested, his wife and kids got tested, and it was fantastic. It worked out great. Just wanted to clarify a couple things that were mentioned before. Everything COVID related is definitely at no cost. And what that means is if someone doesn't have insurance, then it's no cost to the worker or the grower or anyone if you don't have insurance. If you do have health insurance, we ask for your insurance information so that we can bill your insurance company because they're covering it. But there's no out-of-pocket cost to you. So if you would normally have a copay, there is no copay that we're collecting for any COVID-related visits. And we'll go out to a big farm, a small farm, it doesn't matter. Like I said, Xavier, myself, and some more of my team members are available. My team and I are all bilingual, so we bring a personalized in terms of languages spoken one-on-one with workers. Workers can come out if they want to come out at a small group of 1 to 6 people or 2 to 6 people. That's fine as long as there's room to social distance in an outdoor area. And we don't have to be there long. We'll ask workers if they're interested in getting tested and share what the result of that is with the farm manager or operator, and just say, hey, we spoke to this number of your workers today. This many of them were interested. Do you want to just set up a testing event? And if so, then that's great. It's pretty seamless. We come out with a doctor or a medical provider. It could be one of our nurse practitioners, a medical assistant or 2, a patient representative, and someone from the outreach team. So it's a small group, anywhere from 4 to 6 people. And it's a very quick test. I do want to say, however, though, the state Department of Health did just send us a very large, sizable number of test kits, and they are all the longer ones. Again, I just want to be clear with everyone. And I've had one of those tests myself. It's uncomfortable for like a second. It's really nothing to be afraid of. It does go up further than you'd think anything could go up, but like I said, it's a second and it's done. You put your head back, stick it up, it's over. And we go through a very thorough prevention education message with the workers. So you can reach out to us, and we're looking forward to helping to keep you, your family members, especially if you guys have older family members that live with you or are engaging to some capacity with the workers. You have to really, really be careful with them. I use the example, my mom is 80 years old, and I have not been able to hug her since the end of February, just because I'm afraid I don't want to give anything to her. And as our state epidemiologist had mentioned earlier, Shaban, you don't know if you have it or not, because you may not be showing symptoms. So we're just trying to keep people as safe as we possibly can and mitigate the spread. Especially consider those workers that might go out to market, especially set up some kind of screening protocol for them more regularly than, so for instance, the workers that are out in the field. But if those 2 are always coming in contact anyhow, then testing at a regular interval, or when you have newcomers coming on, is definitely possible. So please reach out, and we're hoping to see you soon.
Michelle, there's a question here. If you could explain how farmers can invite a Fqhc to the farm for just education and training, but not necessarily for testing or testing at a later date. Is that a possibility?
Yes, that's definitely what we want to see happen. We'd love for you guys to invite us to come out to your farm to educate your workers. And if you don't want the testing on the same day, you want us to come out and test at a later date, that's fine too. We want to be able to reach out to them, to educate them. So you could, in the counties that Zufall covers, and there is another health center that covers a different county. Zufall covers Morris, Somerset, Sussex, Warren, and Hunterdon. You could email myself, and my email is M, and then it's my last name, which is Blanchfield, B as in boy, L as in Larry, A as in apple, N as in Nancy, C as in cat, H as in Harry, F as in Frank, I as in igloo, E as in elephant, L as in Larry, D as in David, M Blanchfield at Zufall Health. That's Z as in zebra, U as an umbrella, F as in Frank, A, apple, Larry, Zufall Health, HEALTH.org. You can email me, or you can give me a call at 973-328-9100, extension 323, and you'll get a call back within hopefully 1 business day. Schedule that. Email's best. Email definitely works best, but a call's fine too.
And Michelle, we have a question about how long does it take to get the test results?
They're coming back now within 48 hours. That's what we've been showing. And again, that usually depends on the test volume. So there's mass testing going on in a lot of different places now. So we can only bring the results back to the patients that got tested so quick, as quick as the labs can process them. So it really depends on volume, but we've been around 48 hours. Oh, and you could also, by the way, if you have any one of your workers right now, maybe you're not ready for us to come on for whatever reason, or we schedule something, but it's like 3 days from now, but any one of your workers wants to get tested or is having symptoms or just needs a doctor, all of our offices are open. So we have an office in Hackettstown, an office in Newton, we have an office in Morristown, an office in Dover, Somerville, and our dental only office is in Flemington for Hunterdon County, but our offices are open. All of our offices are doing COVID testing, but it's obviously a lot more efficient, right? If you have a whole group of workers, we can just come to you with our mobile testing unit. You can also, you can call any one of those health centers and you can find our phone numbers at our website, www.zufallhealth.org. You can also call Xavier Martinez. A lot of you have his number already, but I'll give it to you. It's 908-268-1106.
It's a little painful right now.
Can you say that again?
Sure. It's 908-268-1106. That's Xavier's number. And his email address is xmartinez, M as in Mary, A as in Apple, R as in Robert, T as in Tom, I as in Igloo, N as in Nancy, E as in Elephant, Z as in Zebra, xmartinez at zufallhealth.org. So the same as mine, the end of mine, zufallhealth.org.
Thanks, Michelle.
Sure.
That was great information. So
There's
I'm now going to.
Another quick question before we go on. Someone asked if a new worker tests negative, is quarantine still necessary?
A new worker that was tested negative. No, quarantine's not necessary if you're negative. However, if you are around other positives, you would have to be separated. Siobhan, do you want to add more to that?
If you're exactly what you said, Amanda, if you don't have a known exposure and you test negative, you wouldn't be quarantined.
So our next federally qualified health center presenter is Bridget Hogan. And I just want to apologize. Bridget covers Ocean Health Initiatives, and the two counties is Ocean and Monmouth County.
Yes, thank you. Hi, Amanda. Yes, I'm here. Yes, can you hear me?
Yep.
Thank you very much for the opportunity to speak this evening. I just want to mimic pretty much everything that Ms. Blanchfield said from Zufall. I understand that FQHCs are considered a safety net. We're here to help people who are uninsured or underinsured and that need healthcare. We have no other hidden agenda. Our role is just to bring that facility to your farms. We have been to 15 farms over Ocean and Monmouth County already. We have tested 79 workers and all negative, thank God, so far. We are willing to come early morning, late evening, lunchtime, whatever the schedule is. We have sent letters out to all the farms in our catchment area. And feel free to reach out to us if you want, somebody there at 6 o'clock in the morning to test workers before they go out to work, or 6 in the evening as they come off the farms. Again, Michelle has pretty much covered everything we do. I did type my contact information and my outreach workers information. I'll hopefully everybody can see it. We are fortunate on our team. We also have an ex-farm worker from Mexico who speaks the language, understands the life, and is now, in the healthcare industry. So he's working with us and has made some good connections there on the farms as well, which has been very successful for us. And I think that's really all I have to say, unless anybody has any questions. No cost testing. As Michelle stated, we will, if there's an insurance, we will take the information and bill the insurance company. If they pay, that's great. If they don't pay, nobody gets billed.
Thanks, Bridget. That was great.
You're welcome.
So the next piece, the next pillars are treatment. So once the worker has suspected or has confirmed COVID, we're going to discuss the cohorting of the workers, our communication plan between the federally qualified health center or any primary care health center and that patient, the return to work, and then, of course, the employment-based protections. The next slide. So the workers with suspected or confirmed COVID-19. So once they are tested through one of the Fqhcs or another testing site or vendor, there is priority to prevent the spread. There is a priority for that worker. And of course, all the partners, the federally qualified health centers and the local public health departments, to work closely with that farmer, that grower, and the worker to ensure that there's less of a spread. So you want to do less transportation with that worker who has the symptoms. If you can't, try to separate them, isolate them as much as you can. I know this is probably one of the most difficult things to do, is to keep them separate in a separate room, separate living quarters with a separate toilet. But this is what the guidance is asking. This is what Department of Health is desperately asking you to do. One strong partner is our local public health departments in your county. We would ask you and the local public health departments to work very closely together to ensure that that worker is getting what they need to get healthier and also to prevent the spread. The local public health departments are equipped. They're equipped experts in the field of mitigating the spread of all types of diseases, all communicable diseases. So allowing the local public health department to be a partner with you along this journey is very important to all of us. Like I mentioned, separate living spaces. Ideally, you want to make sure you want to isolate that worker. If that worker, if there's a group of workers, and we'll talk about this about the cohorting in a bit, but if there's a group of them, you can put them separately. But ideally, we would like the workers to be separated with different living situations, living quarters. We want to identify the workers that were in close contact. That is what the local public health department will do for you. They want to work closely with you to make sure there is some contact tracing, ensuring that there's less spread. So the local public health department will be calling that worker that is COVID positive and asking questions about who they've been close to make sure that their colleagues are not also getting or contracted the virus. We want to ask the grower and the housing provider to provide those essential items for that worker to get healthy during the quarantine or isolation period. We want to ensure that there is adequate food, water, and ideally over-the-counter medication to lessen the symptoms, make them comfortable, and giving them enough space, giving that person enough space and time for a quick healing. Next slide. Siobhan?
Hi, so we were talking about cohorting of workers. And so, again, this goes along the lines of people who are asymptomatic or maybe pre-symptomatic or having mild symptoms. Just because I'm COVID positive doesn't mean that I am too sick to work. It just means that I have the virus. So what we can do is we can group workers that are COVID-19 positive, whether they have symptoms or not, and that they can be isolated together. That means they could be working, they can be in the same living quarters together. They can be working on the same fields together. We can group, the second grouping would be workers exposed to COVID-19, but they don't show any symptoms. They've tested negative or have not yet been tested. They can be kept away from the positive cases. So this way, if they haven't tested positive yet, we can stop the spread of COVID-19 in that manner. We can also, in group 3, workers not exposed to COVID-19 and they're not showing any symptoms, they can remain together with no need for isolation or quarantine because they haven't been exposed and they don't have COVID-19. So therefore, they can't possibly be spreading something that they don't have. We can consider creating groups of workers that house, transport, and work together, but stay apart from other groups or workers. Keeping migrant farm workers who live on the farm's labor camp, migrant workers who live in off-farm housing, and local workers separate from one another to limit the potential spread to and from the farm and also the community. So if I have a group of workers who are COVID-19 negative, they have not been, and they haven't been exposed, then they don't have the risk of getting sick. So if we can keep that group from not being exposed, we're lowering the transmission. So if someone is coming on and off the farm though, and they're interacting, going to stores, things of that nature, then they have more chances of being exposed to COVID-19, and therefore they can come back and they can spread it that way. So if we can keep those different groups separate, we can really reduce the spread and keep all of the workers healthy, keep their families healthy, keep the growers healthy and their families healthy. So it's really just about trying to keep groups of people with similar exposures together and separating those who have different exposures apart from each other. Does anyone have any questions on that? Does that make sense?
There was one question asking about explain what is required for temperature testing for workers in Section 8A of the guidelines. That was for Amanda, but
Siobhan could answer that one. It's the temperature, so the screening symptoms, we're just screening for symptoms before the work shift is usually what we ask growers and other employers to do. For the temperature, that has changed because the COVID-19 virus has changed and we are learning so much from it. We're asking, usually it's 99, if your temperature is over 99. That is considered a symptom. Siobhan, has that changed through CDC?
Not to my knowledge.
And before in the past, it was 100.7 or 100.4, and now it's lowered to 99.
Right, 100. And of course, if you can use a thermometer, a non-touch thermometer, that's best. Otherwise, proper sanitizing after use, which is an alcohol swab, right? An air drum.
did you just say the temperature level went down?
Right when COVID had emerged, and we were still learning a lot about it. In January, February, we're still kind of trying to figure it out. The temperature was 100.4 or 100.7. The temperature below threshold. Now we lowered it, CDC, the Center for Disease Control and Prevention, lowered it to 99. So if your temperature is 99 or above, that's considered a symptom.
This is Wes Klein. Where is that published? We have not seen that anywhere.
I was going to say the same thing.
For the temperature?
Correct.
It's on CDC. In our guidance, we just put a temperature. We didn't put an actual number. We kept it very generic because we wanted to ensure that we weren't giving exactly numbers, because then that it might change. The virus might change.
The problem is the grower needs to know what the temperature is. Saying take the temperature, it could be 97 and that's too high.
Right now, everything that's out there says 101 or 100.7. So if all of a sudden we're telling people it's 99, they're missing a whole bunch of folks. So we need to be able to get that word out if that temperature has dropped.
But there's also other symptoms that we look for. So it's not just the temperature as the only gauge.
But you're asking growers to then be a medical person if they're going to do that when people start to work. That's not fair. If someone is asymptomatic and then you're basing it on temperature, and the temperature is 100.4, which is what we've always been saying and what was in CDC publications, and now you're saying it's 99, everyone needs to know it's 99.
We'll follow up and try to get some clarification on that so that we can update our information too, to communicate with the farm community.
I'm sorry, Rick. We need to have something in writing from the Department of Health that that's what it is.
Right. That's why I say we need to follow up and make sure we get that.
We'll find out through our communicable disease services is what exactly is being posted by CDC. We'll get back to you.
Michelle, you can unmute yourself, I believe, or add a comment. Let's see here. Michelle, you're unmuted now, Michelle.
Hi, everyone. Okay, great. Thanks, Rick. I was going to say I'm definitely not a doctor, but from my own experience, on a warm summer day, when I was outside carrying a box to enter one of the hospitals to get up to my office, they took my temperature. And obviously, my body temperature was going to be elevated, right? Given the level of my physical activity and the temperature around me. So I think it's going to be difficult. I don't think anyone's asking anyone else to be a doctor. I think the ask is call the doctor. And the doctor in this case that's making themselves available to all of you guys are the federally qualified health centers. So you can call us to come out and educate and test your workers to give you a baseline. You can feel a sense of relief knowing that, thank God, as we've experienced so far with the few farm workers that we've tested, the vast majority of them, if not all of them, have been negative. And so you feel a sense of relief. You want to be in that group 3, right? On this slide, workers not exposed to or not showing symptoms. But the truth is, if you're going out to any kind of public area or engaging with other people in the community, you are exposing yourself to this virus. And that's just the case, that it's the unfortunate new reality that we're living in, coming from a public health perspective. That's just what it is. So even going back further, one of the questions somebody had asked earlier that presented was, if someone newly arrives and tests negative, should they be quarantined? And I know the answer was, if they're testing negative, then no, absolutely not. However, again, and this is why I know it's difficult. We're not asking anyone to be a doctor, but everyone has to be careful. You have to find out, like, where is this person just arriving from? Were there recent outbreaks there? I'm hoping to God you guys are having conversations about, like, if people that they were living with or among had been showing symptoms of all. And just to be on the safe side, if you can, keep a distance from that person until you can get us out there to test and confirm that they're tested negative, or they've been there for a few days, right? So they're not like pre-symptomatic. One of the definitions that was shared earlier was pre-symptomatic, so they're not showing any symptoms. And in order to test positive for the test that we're using, the virus has to be, in your nasal passage, right? It's going way up in your nasal passage. But we know that there have been other ways. There have been people that have had COVID symptoms and tested negative multiple times. So unfortunately, there are so many unknowns with this virus, is what we're trying to say. And that's why we're out here trying to do the best we can to confirm that, there are no cases out there that we have to isolate, and keep our communities, which include our ag community, healthy. That's all I want to say.
Rick, this is Secretary. You got quite a bit of material still to cover. And I think this is ending at 9:30. Is that right?
We can go a little bit longer than that, but that's the scheduled time. I'm not sure how many more slides we got to go.
Well, I was going to say, because obviously we have to log the question. The 99 is a question that has to be answered. But I think that they've presented a lot of material around it, that it might not be absolute on every one of these. But I think you got to get a sense of sort of the whole scheme of how this thing is playing out. So I would suggest we keep moving.
Yep, correct.
Sorry, so thanks, Michelle, that was great. But just to reiterate, we're looking at multiple symptoms, not just temperature. And I know Barbara Carruthers from our Communicable Disease Services said for workplace screening, we use 100.4. FEMA sites, however, are using 99.6. So there is a small difference. In our healthcare settings at the hospital, we were using 99.6. So just to go back to the plan, our communication plan between healthcare provider and the confirmed patient is really important. We want to make sure that that worker, the grower, and local public health departments are working closely with the healthcare provider, which is our Fqhcs. So allowing frequent communication between that provider and the patient is really important. We want to make sure that that worker lets the provider know there's any complications, any, for instance, worsening of breathing, any major symptoms that can't be controlled. Also, in case there is a negative testing and that patient wants to recover, they could also do a negative COVID testing. Providing an accurate phone number to allow that patient, health worker, provider communication is also very important. So if the ideal would be that worker, either if that worker doesn't have a phone, perhaps the farm grower or somebody that does have a cell phone, that provider and that patient could speak if needed. And of course, notify the health provider of any issues, any things that change in the clinical status of the patient. Also, some healthcare providers are providing remote telephone assessments or telehealth appointments. So this will assure also that the patient is, of course, having communications with the provider, but is also following social distancing and self-isolation. We also want to make sure that the cost due to the testing and treatment for COVID is not charged by the employer or the worker. So the cost for the testing, there's no state cost for the testing and no state cost for the treatment to the employer or the worker. Any hospitalization that is needed due to COVID and it's provided by the state of New Jersey will not be charged by the employers or the workers. And of course, temporary isolation housing for workers. Right now, we have the Atlantic City Field Medical Station as a site to temporarily isolate workers that need to be isolated or need some low acuity care. That is free of charge to the worker and the grower. And it is a little far. It's in Atlantic City, but it's a 250-bed facility that will provide healthcare, social services to that worker with free of charge. Next slide. Christine.
Return to work. So workers who had COVID-19 symptoms in isolation can be released from isolation and return to work only under the following circumstances. And I also let Siobhan chime in. It's helpful. So workers with symptoms who test positive for COVID-19 must remain in isolation until after at least 3 full days or 72 hours have passed without a fever. And without the use of fever-reducing medications. And other symptoms also must have greatly improved, and at least 10 days must have passed since symptoms first started. For workers with laboratory-confirmed COVID-19 who have not had any symptoms, they may discontinue isolation when at least 10 days have passed since the date of their first positive COVID-19 diagnostic test, and if they continue to have no symptoms. Now, we also know that if a large number of your workers tests positive, that may be really problematic for your operations. So there are possible exceptions when there are large numbers of asymptomatic positive workers, which you could then consider have worked together with face coverings and proper social distancing. And then last but not least, there are also employment-based protections available to workers. And the first thing to remember is that once a worker is hired and put on payroll, that worker is considered to be an employee. And so sort of some of the flagship provisions that are in the guidance are earned sick leave. Really important to remember that workers, most workers in New Jersey are eligible for earned sick leave under state law, but also, and probably more importantly, under the given circumstances, is the earned sick leave that's available under the Families First Coronavirus Response Act, the federal FFCRA, which gives a dollar-to-dollar tax credit when employers provide their staff with earned sick leave for up to 80 hours. Oops, was too quick. So the other provision mentioned in the guidance is that workers are protected against COVID-19 employment-related retaliation, meaning that if a worker has to take time off because a medical professional has determined that they have or may have COVID-19, then they can't be fired for that reason. And finally, workers may also be eligible for workers' compensation if they get COVID-19 while working. Things that happened since we issued the guidance is that the Department of Labor qualified what would qualify as good cause to voluntarily quit or refuse to accept work. And so this is when workers believe that working conditions are so unsafe, unhelpful, or dangerous as to constitute good cause attributable to such work. So while our state unemployment insurance system places great emphasis on work, there are those two exceptions in case a workplace is deemed unsafe, unhelpful, or too dangerous to work at. And last week, the governor also announced the One Jersey Pledge, something that any business in New Jersey can review and sign on to, in which is a pledge between business and their workers, and also between a business and their customers. And the pledge also enables anyone to report public health violations that they may have witnessed. So I'll end here, and we have some time for additional questions.
Okay, so at this point, we can ask people if you want to be unmuted and ask questions, or either write it in the chat box, or there's a little hand either between the chat and the participant box or in the lower right-hand corner. You can raise your hand and be unmuted and talk directly. Otherwise, as we're getting ready for that, I'd like to ask Pete Fqhc and Ben Casella at New Jersey Farm Bureau for a couple of comments to summarize, and as you're getting your questions ready. Ben, are you ready? Pete?
Hello, everybody. This is Pete Fqhc, and I'm in the farmhouse headquarters with Ben, watching the slides on the screen. One of the first impressions I get is that the situation is very dynamic in the field, with the startup of employment to a major degree, and the onset of the compliance activity with the guidance document. And just as we've seen with several of the questions in the chat box, I think there will be the emergence of other questions in the days and weeks ahead. And I want to throw a question or make a comment to the Department of Health representatives. If we could continue to have some sort of a shortcut to policy answers on questions that emerge that can be communicated in turn to the farm employers. I would like to think that there would be a working committee of growers, extension, and Department of Ag continuing in their role. But if we could get an agreement that this very useful dialogue we're having tonight can continue and be available to answer quickly these kinds of questions that we've talked about tonight. Another point that I would have is this is a good discussion among those who are present and available on the phone, but looking from the aggregate, there are many farm employers that need to receive this message. And I would encourage those farmers on the phone here to spread the word, so to speak, with fellow growers about what they've heard tonight, that the agencies have stepped forward and are willing to answer questions and explain the document, that the Secretary is providing the leadership to host these meetings, and that the Fqhc medical teams are offering a helpful hand in providing explanations about COVID and how it behaves, and an explanation of the preventive recommendations in the guidance document. So I think we really need to double up on spreading the information and encouraging other growers to use the extension service opportunities to learn about the guidance document. I'll ask Ben if he has any comments, and I'll make one more when he's finished.
Well, no, I think Pete did an excellent job of covering the concern, you know, and that's the thing with dealing with labor on farms, and I deal a lot with labor laws, is that there's always unique situations because every farm has its unique type of operation. So it's good to have an open communication with those entities that are involved with meeting compliance for. I know we've had a excellent relationship with federal and state Department of Labor's on labor laws, as Rick mentioned in the startup with previous meetings, but this is an excellent opportunity to develop new relationships with Department of Health, as we're in a situation we've never have had to deal with in the past.
Yeah. And I'll finish by building on Ben's last words there. This is a brand new situation, and the best recommendation or position that a grower could take is to be proactive despite the uncertainties. In other words, the uncertainties should not paralyze this with inaction, but rather do the homework necessary and be proactive. What ways to be proactive is to develop a plan of action for the farm. Literally have a written plan as to the steps that would be taken by the farm on behalf of the workers and family and the visitors to the farm. Write it down and execute it. And then when it's executed, to document the dates and how it was done. That written record of doing a plan and having it documented becomes a demonstration of good faith effort to comply with the spirit and the content of the executive order that does have the force of authorization coming straight from the state government and the governor. So the plan of action and the be proactive is the way to counter the puzzling aspects and the uncertainties of this virus that really came out of nowhere and caught everybody by surprise, but a concerted effort to respond to it with the leadership of the state agencies and the good work from the Fqhc centers and the county health departments. We hope to have all the bases covered, but I'll repeat the need for ongoing quick ability to have decision making. This temperature taking conversation that we had is a good example. And I also have a few questions later on after the others on the call have a chance to ask theirs about this addition that was not in the guidance on the unemployment insurance, but we'll come back to that later. Thank you for the opportunity, Rick.
Thank you, Pete and Ben. And at this point, I don't see anybody raising their hands or typing any questions. I'm going to give you one more chance. George Campbell, I noticed, was logged in twice, and one said he wasn't paying attention, but he had asked one question earlier and raised his hand to ask another, but I'm not sure if you're still there, George. If you are, we can try to unmute you.
Try to unmute me.
We just unmuted somebody.
Okay, can you guys hear me?
Can hear you, but we got a wild echo there.
Yeah, somebody else.
Try again.
Hear me now?
I can hear you. Go ahead.
I just earlier, one of the growers, like I had written, they were asking about wearing a mask in the field, and I told them yes. You know, I mean, I think the more they can put up with that, the better. You know, obviously, they'll probably take it off sometimes. That was my thoughts.
And I think that's what the recommendation was if they cannot be separate, then definitely there should be a mask on.
Okay.
And the big thing that we see when you're driving through the fields, it would be easy enough to have workers distanced as they are picking. In a blueberry field, you're already 6 feet apart, just row by row. But in a
Right.
vegetable field, just split the guys between the beds. Put an empty bed in between them. That puts them automatically more than 6 feet apart. And if they want to work side by side in the beds, then wear the masks. Simple as that.
Yeah, I agree.
Am I correct in interpreting what you said, either Amanda or Christine or Siobhan? Siobhan? Hello?
Yeah, I didn't know if Siobhan was going to answer, but yes, exactly what you said. You know, 6 feet apart, sleeping arrangements separated as much as we can. Yeah, it's exactly whatever we could do to mitigate.
Sorry, I wasn't fast enough to unmute myself. I apologize.
And one of the biggest concerns that started us really jumping up and down in asking for this guidance several weeks ago was understanding that come blueberry season, which harvest started in full swing this week, we were going to have thousands of workers in the Hamilton area alone. And I saw that Denny Doyle was able to join us tonight. And I had a long conversation with him yesterday that the blueberry industry has really stepped up. He was surprised when he went to visit several of the farms, not only in putting up barriers between bunks, but also putting up plexiglass barriers between people working on packing lines and the like. And that's the type of progressive action that we want to see all farmers take in pursuing or protecting their workers, protecting themselves and their families. So again, I'll give you one more chance if anybody wants to either raise their hand or type in a quick chat message question. And if not, I want to thank all of our speakers tonight and presenters. Thank Doug Fisher for joining us, as well as Monique and Amanda, Christine, and Shaban, and all our Fqhc reps. Thank you for joining us and making this presentation. The more we spread the word, the more we're going to be able to protect our ag community. And I appreciate all of you chiming in.
Thank you very much, Rick.